and welcome back to another episode of Dr. T on Call. I'm your host, Dr. Toiya Turknett, soon to be Dr. Toiya Thomas, also known as Dr. T. I'm a board-certified internal medicine physician, and I am excited and a little scared to talk to you about today's conversation. So if you're watching this, there is a high probability that I'm in surgery right now. Today's episode is about uterine fibroids. Recently, I found out that I have uterine fibroids, and today I'll be undergoing surgery called a myomectomy for removal of these fibroids. This topic is very near and dear to my heart because it affects me as well as many women like me, many Black women, especially in their 30s, in a disproportionate way. So I'm going to try to not get too emotional during this because there are a lot of logical, but also a lot of emotional feelings around this topic. But this is something that we need to discuss as a community, as a medical community, as a Black female community, as a physician community, as humans. We have to have a better understanding of fibroids so we know what they are, how to treat them, and how to hopefully reduce them occurring and recurring in the future. So because I am a physician, I'm also an educator. So before we start talking about my story, let's actually talk about what uterine fibroids are. So the medical term for uterine fibroids is leiomyoma. So uterine fibroids are non-cancerous tumors that can grow in just about any area of the uterus. If I was an OBGYN, I would more than likely have some type of actual module to show you, but I'm an internal medicine physician. So we're going to use our imaginations, but I'm going to show you a little bit more and teach you about uterine fibroids. The uterus is normally about the size of a fist. So we'll use my fist. It's almost the same shape as a uterus. Uterus is the shape of an upside down triangle, lies just under the pelvic bone. So the uterus has an outer lining as well as an inner lining. Normally, the lining of the uterus in total can be between 5 millimeters to 12 millimeters in size, depending on where a female is in their menstrual cycle. In the uterus, the outside lining of the uterus normally does not grow or change during the different phases of the menstrual cycle. However, the inner lining of the uterus grows and gets thicker in preparation for a possible fertilized egg to attach. But if a fertilized egg does not attach in the month, then that inner lining of the uterus sheds. And that is the period. So uterine leiomyomas or uterine fibroids are actually tumors made of uterine tissue. They can occur anywhere in the uterus. They can occur on the outside of the uterus. They can occur on the inside of the uterus, and sometimes they can occur within the muscle or the different layers of the uterus. So if we're imagining that this is the uterus, like I said, the uterus is an upside down triangle, but there's always a little area of opening in the middle called the cavity, which is where, if there was a fertilized egg, that's where the egg would attach. Or this is the cavity in which the uterine lining would shed for a period to occur. So this is going to give you some backstory as to how I ended up even finding out that I had uterine fibroids. My story about fibroids is not common at all. It's not your typical story. And that's why I think it's so important for us to have this conversation, because I don't know the next time you would hear this type of story, but it might actually make you want to look into some things as well. Normally, when women are being evaluated for uterine fibroids, they have some common symptoms. The more common presentation of uterine fibroids is a woman who is having very heavy menstrual cycles. And when I say heavy menstrual cycles, it really means that a woman will be soaking a pad within a 1 to 2 hour span consistently, to the point where they're losing so much blood during menstrual cycles that they can actually become anemic and not have enough hemoglobin in the body to sustain the body. And so a lot of times in that evaluation, That's where imaging will take place, and we can determine that part of the reason for the bleeding is because they're uterine fibroids that are made of this uterine tissue are causing heavy bleeding. That was not my case at all. I actually am not anemic. I have pretty regular menstrual cycles, but nothing where I have extreme bleeding. However, I recently got engaged. Now I guess it's not so recent, but last April I got engaged. And I wanted to make sure that fertility wise, I was as prepared as possible. So when you're looking into the thoughts of fertility and making sure that your body is as optimized as possible, there's an aspect of it where there's genetics and there's hormones that you want to make sure are at appropriate levels. There's the quality of the egg and the quality of the sperm that you want to make sure that are at appropriate levels. But there's also a question of the structure of the uterus. Is the uterus structured in the way that it can hold a fetus if it did become pregnant or if a fertilized egg was in there? And I knew that the women in my family have had a history of uterine fibroids. So I actually asked my primary care physician if she would order a transvaginal ultrasound. It's a special ultrasound that it's actually two-part. They do the ultrasound of your abdomen to look at the uterus, and then there's also a part that goes through the vagina that also can get better images of the structures. Like I said, I had a suspicion. I'm a woman in my 30s. I've never had children, and I have a high family history of uterine fibroids. I had a suspicion that I would probably find some small uterine fibroids that probably would not require any type of surgical intervention, but I wanted to know. So I get the transvaginal ultrasound, which then prompted for me to also need an MRI of the pelvis because on the imaging of the ultrasound, I was found to have 3 very large uterine fibroids. I haven't really talked about this out loud in detail, so I'm trying to, if you see me get emotional, that's what's going on here. So I was found to have, like we talked about, if this is the uterus, all of my fibroids are actually on the outside of the uterus, which is why I wasn't having any issues with heavy menstrual bleeding. However, I have 2 grapefruit sized uterine fibroids on the front of my uterus. They're about 12 centimeters apiece. So if you can imagine 2 huge balls on the front of my uterus, and then I also have a large orange size or 8 centimeter fibroid on the back of my uterus. They are pressing on my bladder as well as pressing on my colon. And that was completely unexpected news when I found out. So now let's get out of doctor mode and get into human mode. Of course, the way that my medical system works, once the results of the imaging come out, they come straight to your portal. And so I opened up the results of the portal, and the first thing that happened, my doctor mind set off. I read the story of the imaging, and I said, oh, okay, they're on the outside of my uterus. I know that they're large. I don't really have to intervene upon them because technically my uterus is appropriate size. There's nothing going on that could stop me from becoming pregnant. And that was my initial thought. I was also working. When I'm working, I am in doctor mode. So there are very few things that can kind of knock me off. But then I got off of my service and I was off of work for a couple of days, about 24 hours later. And then the reality of what I read actually hit me. That normally, if we're talking about a fibroid that large, especially grapefruit sized fibroids, which we normally call them grapefruit size when they're greater than 10 centimeters, you need to do some intervention upon them. And so then the nerves started kicking in because I've never had surgery besides minor surgeries in childhood. I never had any big major surgery. I was surprisingly also feeling betrayed by my body. I felt like, buddy, I treat you pretty well. We go to the gym 3-4 times a week. We eat good food. We drink a lot of water. How did I not only, I mean, having fibroids, I wasn't super concerned about, But having fibroids this huge, how did this happen? And I not realize this was going on in my body. And now I have to do something about it because of how large they are. And so it took me a couple of days to really wrap my head around the fact that this is going to need intervention. And with the size of them, this is probably going to need surgical intervention. But as in all of the 5 stages of grief, then I went towards rationalization. And I was like, well, I'm not really having any symptoms from them. I'm not anemic. I have regular cycles. This shouldn't be as big of a deal. They're just large. But then I started really thinking about what I know about uterine fibroids. And I realized that I have had a lot of symptoms from them that I just did not attribute to uterine fibroids. So, yes, the most common can be very heavy menstrual cycles, which can cause anemia. Those are two of the most common symptoms. However, other symptoms that can be secondary to uterine fibroids include a feeling of constant abdominal fullness, feeling like your lower abdomen just is constantly protruding, constipation because of the location of the fibroid. It can press on the colon and make it difficult to have stools, or you have bowel movements and your bowel movements, instead of being regular size, they can almost start getting smaller and smaller till they're coming out sometimes pencil thin. Also, sometimes depending on the location of fibroids, they can cause abdominal pain as well as constant or increased urinary frequency or the urge to urinate. And so while I did not have any of the heavy menstrual periods, I realized I've been dealing with symptoms of these uterine fibroids for so long. I actually thought that suffering was supposed to be my daily ritual for years. There are times when I'm working, will walk around and have this sharp, stabbing lower abdominal pain that lasts for sometimes a couple of seconds, sometimes a couple of minutes, and then it goes away. And I've gotten so used to it. I know when I have to take a break or I have to rest, and then I can get back to it. But it's been going on probably for the past at least 6 to 7 years, to the point where I did not realize that this is not common. I have chronic back pain to the point where I started working out actually to strengthen my back. And so a lot of the areas of my back that used to have pain, I don't have, but my lower back, I have chronic pain where I always have to massage my lower back when I finish, which now I can probably attribute to the uterine fibroids. If you know me, I am always having to run to the restroom, but I attributed it to the fact that I drink a gallon of water every day. So I didn't think it was that big of a deal that I always had to run to the bathroom. But even when I didn't necessarily have to go, I always went because I always feel like I have to go to the bathroom. There's never a time that I don't. I just have mentally trained myself to know when I actually do. And that urge of constantly having to go to the bathroom came from the fact that I have two grapefruit-sized fibroids pressing on my bladder. And then lastly, the abdominal pressure. I always feel pressure in my lower belly. And I did not realize, like the other symptoms, that it was causing me problems. I'm so used to waking up with this feeling of deep abdominal pressure and sometimes pain that normally before I get out of bed, I have to roll and lay on my stomach for about 10 minutes to kind of calm down the pressure and pain. And then I get up. I've done this for years. I would like to note that this is not a medical advice or a medical recommendation, but this is a personal thought. I do believe that women in their 30s, especially women who are looking to conceive, should at least get an ultrasound to evaluate to see if you have uterine fibroids. Because you don't necessarily even have to do any type of intervention, or in a lot of cases, things don't have to be done for them, but it's important information to have. Because if, like in my case, I had not gotten my imaging done, I probably would have never known I had these large uterine fibroids until I was pregnant. And that would have been a completely different set of circumstances and complexity because in pregnancy, I could not undergo any type of surgery or procedure to remove these fibroids. So, this all is how I got to this point where now I'm probably in surgery and I am asking and requesting and already thanking you in advance for all of your well wishes and thoughts and prayers. So, because of the size of my fibroids, I am undergoing a myomectomy, meaning those large fibroids will be removed, but it also still preserves my uterus and preserves my fertility. And actually, the surgery will help me in fertility. And the fact that now, with these large fibroids, let's say 24 centimeters worth of fibroids, this is what's dealing in the front of my abdomen right now. 24 centimeters worth of fibroids will be removed so that when I do become pregnant and as that fetus grows, it actually has room to grow. And also that I will not have extreme pain during pregnancy. And so here we are. The things that I hope that we can learn from this podcast are a few things. This journey of finding out about uterine fibroids has taught me so much about myself, as well as set off signals for me to be better to myself. There are a lot of factors that go into how uterine fibroids form and progress. Some of them we understand very well. And when I say we, I mean the medical community. Some of them we don't understand so well. But we do know that uterine fibroids are present disproportionately higher in Black and brown women. We do know that there's some genetic component, but there's also some hormonal component, as well as stress-related and lifestyle-related component of uterine fibroids. Finding out about this diagnosis has made me take a moment to assess myself, assess my life, and assess how I'm living my life. I love practicing medicine. I love doing the hard things because hard things tend to have the greatest reward. However, as I'm getting older, I'm learning the importance of doing things in ways that keep my peace as top priority. There will probably never be a time in my life where I won't do difficult things. But now I am starting to focus on reducing stress where I'm able to. Because constant stress, neglecting my body in order to focus on taking care of others, it doesn't help me in the long run. And it is my job and my responsibility to make sure that I am creating a life of longevity and wellness for myself as well. So here are the things that I've been working on, and I hope we can adopt some of these things as well towards living a better and a more fulfilled life, as well as a more stress-reduced life. Like I said, there are some areas of my life that I cannot reduce the stress. I work as a hospitalist. Part of the job is knowing that anything can happen at any moment. So what I've learned to do is when I'm at work, I'm giving work 100%. I am on it. I'm focused. I'm easy to access for all of my nurses and my patients. It's important for me to be fully focused and ready so that when those emergencies happen, I can respond quickly. However, when my time of work is done, I am equally as focused on my rest and my disconnection from the chaos. And that has allowed me over the past couple of months to start renewing myself during my off time. I leave work at work. I don't sit at home and ruminate on what I could have done or what might be happening. I allow my colleagues and those who are present at work to take that baton and keep carrying that torch. But it is my job that is equally as important as the care that I provide to others. It is my job to make sure that I am restoring myself. The second thing that I'm learning how to do is become very clear in who I am, what I do, and what I don't do. One thing people have warned me about, but it is a completely different thing when you're going through it. Something happens in your 30s where you become very clear on who you are. And sometimes that new definition of who you are can be scary, it can be enlightening, but also sometimes it's not the most comfortable for the loved ones around you because they're used to you being this very accessible person in every atmosphere. And then all of a sudden, you start coming up with these are things that I can do, these are things within my capability, these are the things that I will do, and then these are the things that I won't do. These are things that I won't tolerate. And it is a strong and a hard transition. However, when you start having a better understanding of who you are and you start standing in who you are firmly and committing to the things that you know that you are made for and the things that you can do, you allow yourself to reduce a lot of the noise that can cause you stress, that can cause you to stay up late at night, that can make your shoulders tight and your back tight. And we have to do this because we live in a world where everybody has an opinion on how we're supposed to live life. Everybody is telling you how when you're doing one thing, you're not doing enough of the other. However, when we can narrow down who we are and we can focus on what we can do, we can give that 100%. We also now allow a space for us to rest. And it actually produces more space for us to grow because now the noise has been reduced. Now we recognize the fact that we are created for what we are supposed to do, not what everybody else is supposed to do. And then lastly, and it's not lastly as far as importance, but lastly, just on this list, I am taking my health much more seriously. There are certain things about health and fitness that I love. I actually really love working out. I love lifting. It is great stress relief. You sleep like an absolute champ when you lift consistently. So I love that. But y'all, if I am being honest, eating and stress eating or comfort eating have been crutches for me, especially in a career and in a life where I've had a lot of stressful moments. However, I am at the age now where I can tell after a meal if the nutritional content of that meal is accurate or not. And I have started focusing on making sure that my nutrition is better because I need the strength, I need the endurance, and I need the grace to be able to live the life that I was supposed to live. And that life that I'm supposed to live is supposed to be one that blesses others, where I can help others, but I also have the endurance to be able to work hard, rest hard, and play hard. And so my focus now is making sure that my overall health is top tier so that I can be present for all of the things that make my wellness so much better. So, guys, we got through this episode without crying. I'm very proud. But I also want to hear from you on this topic. Uterine fibroids, it's so common. It's so common that it bothers me how common uterine fibroids are. I feel like every Black female physician who I follow on social media, almost all of us have had some type of journey with uterine fibroids requiring surgery or procedures. And we just need more than that. We deserve healthcare that focuses on fixing a problem that's a big issue. And that's something that we have to look into more. We have to figure out how to reduce the occurrence of uterine fibroids in such a specific population. Also, lastly, I do want to note this because it's also very important. And it's also a reason why I want you to get evaluated, undergo imaging if there's any concern that you're having symptoms associated with uterine fibroids. The procedures and the options today are completely different than the options that were available 10, 15, 20 years ago. Previously, you would have to undergo a big surgery to remove these fibroids, and depending on the severity of fibroids, you would have to undergo a hysterectomy or complete removal of the uterus, secondary to the size of the fibroids. There are so many options as far as from medications to less invasive procedures to less invasive surgeries to sometimes requiring more invasive surgeries. But there are so many options available today. You do not have to live in constant discomfort. I want you to take control of your health. So thank you. Thank you so much for giving me this space to be able to share with you something that is really close to my heart, is something that directly affects me and also could affect you as well as your loved ones. My goal and my hope for you is that we take a more hands-on approach to our health and our wellness and stress reduction so that we can live whole and full lives. I want you to take time this week to come up with your health plan, to think about the things that you might have had questions about, but you haven't actually looked into, and to come up with a plan as to how to get that evaluated. If any of the symptoms of uterine fibroids that I talked about have rang a bell to you and made you go, you know what, I have some of those symptoms too, consider talking to your provider about that and see if we can do something about it as far as imaging or examination or lab testing to look a little bit further into it so that we have the information necessary to make holistic decisions about ourselves. Again, I thank you. I thank you for your thoughts. I thank you for your prayers. I thank you for your well wishes. And I look forward to talking to you again soon. You all have a good one. Bye.